Hello, I'm Carly Christensen, Area Community Relations Director at University House Issaquah. Before we start today's presentation, I just want to share a little bit about our community. So I'm going to share my screen. If you have questions today, you can type them into the chat box, or you can email them to isqcr@airliving.com, but we will leave you muted throughout the presentation. University House Issaquah is located in northeast Issaquah. We're kind of up on the hill behind the Home Depot and Fred Meyer, if you're familiar with that area. And if you take a look at the photo of the front of our building, on the second floor there, you can see our terrace deck. And I took a picture from the deck the other day, just so that you can see the view of the mountains. So we're really kind of up on the side of the hill, gorgeous view of the Issaquah Valley from our community. And we've had a lot going on here the last few months. A lot of folks ask if we are open and if activities are running as usual. And really, we're pretty much back to normal. This is our pool and spa, which have been open for a few months now. We also have our Gilman Auditorium open. This is an event that we held last week where we invited a PhD candidate to come and speak about her research on coral reef presentation. So we are hosting our own events, but we are also able to bring in outside presenters for our residents as our presenters are fully vaccinated. We also have residents who are running events for one another. We've got a resident who is teaching a painting class to other residents. So this was one of the paintings that they were working on last week. So lots going on here. We are proud to be an Air Living community, one of 8 premier retirement communities from the Air Living family. And we are devoted to lifelong learning and healthy living through lots of different types of programming for focus on mind, body, and spirit wellness. And we are honored to host Barbara Cochrane today. Stop sharing my screen here. There we go. Barbara is the Tornyay Endowed Professor for Healthy Aging at the UW School of Nursing, where she's led nursing and interdisciplinary initiatives for healthy aging and elder-friendly futures for the last 15 years. She's also a joint associate member at Fred Hutchinson Cancer Research Center. Barbara, I will go ahead and hand it over to you. Thank you so much for joining us today.
Great. So I'm going to share my screen and hopefully this will work. I can't tell you how thrilled I am to be here today. I've actually been to University House Issaquah several times, although not since the pandemic. And it is just a beautiful, beautiful site. I just wish I could see you all in person. We were just having a conversation that we're all getting a little tired of this virtual world. So maybe next time in person. I did want to mention that the title of this talk, Aging from the Inside Out, came from Reba de Tornyay, who maybe some of you might know. I actually recognized a couple of the names of the participants today, which was cool. But Reba de Tornyay used to do a lecture in my biology of aging course at the end of the lecture, at the end of the course, and she called it Aging from the Inside Out, where she talked about her experience of getting older, which helped our students really tie learning about biology and the physiological changes of aging and apply it to real life. I'm hoping the lecture today will follow that a bit, except in reverse, in that you are all experiencing aging. I'm technically an older adult now too, and but we all feel very young, right? And can think about having increased awareness about these changes and what that might mean for your health. So I'll just get started. We're going to talk today about the physical changes that you are probably noticing, have noticed, and thinking about what's normal or normal biological changes, as well as what are some common age-related physical health changes. I make this distinction in class. It's useful for students. It's useful for us to know there are some changes that people think are aging, but it's really, we just see them more often in older adults. Dementia is not a normal change of aging, for example. It's an age-related change in that we see cognitive changes more often in older adults. And so that's that distinction between what's normal and what's age-related. And then we're going to talk a bit about living wisely, health promotion for older adults. So as I said, normal biological changes of aging are different from those age-related changes. And I think it's an important point to remember that normal aging begins with conception and it continues throughout our lives. I do a lecture on late adulthood with our lifespan growth and development students. And I always remark on the fact that the lecture is called aging, and yet they've been learning all term about aging, including aging of infants and children and young adults. But normal aging is universal. That's what we mean by biological changes. It's inevitable. It is progressive. It progresses along. I would challenge anyone, and I particularly try to challenge students to think about the notion that it is not always bad or what we might call deleterious. Instead, there are some real strengths that come from aging, and that's part of aging from the inside out. Older adults are very diverse. They defy generalization. Some people, you may be aware, think of us as particular older adults as particular kinds of people with particular feelings and particular ways of doing things, but older adults are just as diverse as any other age group, and I hope that the people you're in contact with, the health professionals, are always stay aware of that. Healthy aging starts at the beginning of life, but it's also important to know that when we meet other older adults, these are survivors. Even if there are health changes, these are people who have survived this long. So their health is an important thing to learn about. Health at older ages varies quite a lot. And it's important to know that poor health is not inevitable, and that quality life, good life, happens even when people have chronic illnesses. So I'm going to kind of march through, almost like, if you can bear with me, a biology of aging class where I march through the different internal changes of aging that we might notice. For example, with the heart, the blood flow around the heart, what we call the coronary arteries, does decrease a bit as we get older. There are changes in the cells that are the pacemakers for the heart, that make the heart beat and that promote the electrical conduction, such that it means the heart is a little bit less effective at pumping. The heart muscles thicken, heart valves and arteries stiffen. I would presume that some of you have had some health experiences related to these changes with the heart, but the normal changes in the heart with aging really have only a minimal effect on resting heart function. It's when we get very active, exercise, that we might notice some changes in our tolerance to exercise as we get older. For blood vessels, a progressive change of aging is the development of atherosclerosis, or what some people call plaque, with some progressive hardening of the arteries. But atherosclerosis is also not a normal biological changes, even though we see it. It really is happening as a result of things that we're exposed to and how our bodies function in the world. The blood vessels are less elastic, so they don't respond to changes as much. And so there is a slight increase in blood pressure because they're a little bit stiffer. But some age-related health conditions, not normal, but more often in older adults, includes high blood pressure, or what's called hypertension, and as well as a low blood pressure with standing. Some of you may notice this. If you get up suddenly from bed or from a sitting position, you might have experienced a little bit of dizziness, and that's known as orthostatic hypotension. That low blood pressure is caused by problems with the blood just returning from the lower legs. It just doesn't happen as quickly. You've got a little bit of, hopefully that's not on my end. But all of that, those kinds of changes are related to these sort of gradual biological changes, and they become a health condition if they progress. In other words, an age-related health condition. Thinking about our lungs, taking a deep breath, there is a decrease in our ability to clear our airways. In other words, to cough, to move air down so that particles don't accumulate. Lung capacity, the amount of air that the lung can hold declines as we get older. And just as I mentioned for blood vessels, the lungs are less elastic, so they don't expand and contract as easily. And what ends up happening as we get older is that the air spaces in the lungs enlarge, they don't contract, and we end up having air trapping. What that means is there's air left in our lungs after we, blow out as much air as we can. Maybe some of you have had those kinds of tests. If we blow out as much air as we can, there's still air trapped. And so that means that there's not as much room for good air to come in and the bad air to go out. And so the good air, which has all the oxygen, doesn't circulate as much, doesn't circulate as readily. And that actually relates to, in part, to the changes that we experience with exercise tolerance. So because of these airway changes, because of the changes in our lungs, there is a little bit of decreased oxygen circulation, particularly with stress or exercise, not so much at the resting. But age-related changes to all of these include maybe an increased risk of infection because we're not able to get things coughed up and the bad air out, as well as problems somewhat related to smoking, but also asthma. So emphysema and bronchitis might show up more for older adults. The immune system is a big consideration, particularly right now during the pandemic. And the impact of coronavirus or COVID-19 on older adults has been a huge topic of concern. We saw some real problems early on as older adults were seemed to be spreading among older adults, and in part that's because the efficiency of our immune systems decline as we get older, somewhat to a varying degree. Our non-specific defenses become less effective, and by non-specific I mean things like coughing. When we're irritated, when our throats are irritated, our skin is a non-specific defense. Our ability to blow air out, the fact that our skin is also back to skin, the fact that it is a lot thinner means that it's less of a defense to injury and infection. And we have a decreased ability to make antibodies when we're exposed to infectious things. And so some age-related changes that are not necessarily happening in everyone, but it is common that infections might be more severe. It's why you are, it's recommended that you have a flu vaccine each year, that you should have had a pneumonia vaccine, shingles, and it may be that we're headed into an era where we have boosters for the COVID-19 vaccine as well. And that relates to the fact that infections can be more severe in older adults, and we don't combat those infections. Recovery can be slower. There's a decreased chance of developing that immunity once we've had the condition. And then autoimmune disorders increase. So an age-related change that we see as we get older are things like cancer is an autoimmune disease, multiple sclerosis, various changes, lupus, some of those kinds of autoimmune disorders. Some thyroid conditions are autoimmune. So those are age-related changes that seem to happen because our bodies aren't combating the processes as much. And so, as I mentioned, vaccines are important even when there's not a pandemic. And I hope you've been keeping up with your vaccines and staying tuned to what's needed, because it looks like in about 2 or 3 months, we are going to start hearing about boosters and when those are available and for the COVID-19. Some of the neurological changes of aging are that the brain actually does decrease a bit in size and weight. The size of the cavities or the ventricles, those are the cavities within the brain, increases. And so there are fewer neurons and lower neurotransmitter, which is the substances that communicate between the nerves within the brain. That's part of the reason why the cavities are increasing in size, because there's not as many neurons and substances within the brain. There are often increased deposits and something that's known as neurofibrillary tangles, and those have been associated with dementia, but some of that development of those deposits and those tangles is normal. It's just as it develops more and more that we would start to worry. I also want to mention, because as I said earlier, some people think that dementia is a normal part of aging. I know many of us are really concerned about cognitive changes when we get older, but there's an intelligence that's sort of a cognitive way of thinking that's known as crystallized intelligence that's really quite resistant to aging. And those are things like remembering people's names, remembering facts, remembering how to do things that you learned over your life. Those kinds of things are resistant. Recognizing faces is another one. Fluid intelligence does show some decline with aging, but that's things like learning new facts, being able to link some things that you see in the environment to other facts that you're learning. We do see some decline with aging in that, but there's a lot of strategies that we can adopt to address those changes. I don't know how it is for you, but Post-it notes are a big thing in my life now to keep track, because fluid intelligence includes that declines with aging includes that issue of remembering to remember. So Post-it notes can help. Some age-related changes that we see as people get older, but not in everyone, is Alzheimer's disease and related dementias, Parkinson's disease, the neurological changes associated with stroke. And although stroke can be prevented for many, we don't have real prevention strategies yet for dementia and Parkinson's disease, but there's great research, and you probably have heard most recently that a drug was approved for treatment of or addressing the symptoms of Alzheimer's disease. And so there's just a lot of research going on, very, very hopeful. Some of the sensory changes with aging that we see start occurring even at age 40 to 50. So vision changes, it's known as presbyopia. The lenses of our eyes thicken. They can become a little bit more yellow. Some of you may have already had cataract surgery. That is one of those age-related changes. It doesn't happen to everyone, but it is related to this thickening of the lens. Decreased sensitivity to picking up contrasts. So I've got this photo here as a very low contrast thing. And then there's delayed recovery, or it takes a little bit longer for us to adjust when we move from light to dark. That's all related to the normal vision changes of aging. We also have normal hearing changes, although not everyone needs to wear hearing aids. Presbycusis is one of those things that happens to everyone. And maybe you're getting the idea that the phrase presby refers to older adults or changes with aging. And so the hearing changes that we see are a gradual loss of hair cells, those hair cells in the ears, as they sort of wave back and forth. That's how we pick up and differentiate sounds. So we might see some loss of high frequency sounds. It's kind of easier to hear and understand men's voices, adults' voices, as opposed to women's and children's voices as we get older. And there's some difficulty with speech discrimination. I tell the students that if they're going to take their grandparents out for dinner, that they should take them to a quiet place, because it's hard to distinguish when there's noise going on all around, to be able to hear what somebody sitting in front of you is saying. We also have changes with smell. There's decreased receptors that sense smell and perceive smell changes. A lot of that can happen as a result of various infectious processes. You probably heard that a change in the sense of smell has been associated in some people with COVID, but some slight decrease we do see more in older adults. And there is some sense that taste of foods change as we get older. Maybe a decreased ability to pick up changes between different types of food, salty versus more savory or sweet. But in part, that change of sense of taste is more related to our change in smell, because how we taste things is very much related to how things smell. And so what we might think of as changes in our taste is really that the whole integration of our sensory systems is playing a role here. And then touch and balance is kind of a sensory thing. And so just to mention that there is some changes in how we sense things with, like, our fingertips, how we discriminate between changes. And for example, there's a slower reaction time for it's a very innate reflex to pull away from painful stimuli, a hot stove or something like that. That reaction time is slightly slowed. And then we have some vestibular or balance changes as we get older. Again, these are normal changes. They're very slight. They usually are not associated with a health problem. But if there are health problems, these kinds of changes can make those problems more challenging. Gastrointestinal changes of aging, although we hear about it a lot from older adults, there's not a lot of research that says there's huge changes. There is some mouth dryness, some recession of the gums, but that can be related to medications or whether you've been taking care of your teeth and your gums over time. For the esophagus, there's sometimes a slight decline in sphincter function. You maybe know this as GERD or hiatal hernia, because of changes in the stiffening of the wall of the esophagus, or the pipe that goes down into your stomach. might see more decreased movement of the stomach. So food might stay in the stomach longer and you might feel full longer, or you might get full more quickly than you have in the past. And within the stomach, the cellular protection around the gastric mucosa, you know, the inside of the stomach is a very profound mucous membrane. As we get older, that protection is not as great. And so foods like spicy foods might irritate us more. With the intestines, we hear about intestinal changes like constipation, but we don't see as much change as you might think, other than some slight decreased motility. The intestinal changes that you might experience with constipation are often medication and activity related. As you get older, if your medications are changing or if you're less active, you might also notice more constipation.
No.
With the bladder, there are more contractions of the bladder, and it doesn't seem to empty as well. The urethra, or that tube to the outside world from the bladder, is thinner and it's weakening. So there might be some slight loss of urine. And then the kidney, which, you know, feeds the urine into the bladder, there is some wasting away or atrophy of the vessels. So there's decrease in the kidney size, in the renal perfusion and filtration. It's a lot of technical terms, but I mention it because the age-related changes that we see in the kidney can have a huge impact on how we respond to medications. Maybe some of you have noticed that medications you've taken for years and years and years, as you got older, you had to make some changes because you didn't tolerate them as well, or you had more side effects. And sometimes that's because of the changes that you have in the kidney, maybe some changes in your liver as well. Those are the two big organs that metabolize medications. Some age-related changes that we don't see in everybody, but we do see more often in older adults, is an increased risk of urinary incontinence. Now that is not typical. So please, if you're having problems with urinary incontinence, see your healthcare provider. It does affect women more than men up until about age 80. And then it's the issues with urinary incontinence is about similar. It can have hidden consequences, and people often manage it themselves because they think it's to be expected. I'm just going to have to deal with it. And there are a lot of products out there, pads and panties and things like that, for people who have dribbling or dripping, but it is not normal. And I'd encourage you to see a healthcare provider to see if there's something else going on that can be done. Urinary tract infections happen in older adults. And I mention that because they sometimes can have what we call an atypical presentation. In other words, perhaps you're feeling more exhausted or even a little bit more confused. So you go to the doctor about that issue. And just incidentally, they might do some tests and discover you have a urinary tract infection. This is a common thing that we see in the world of gerontology. Treating the urinary tract infection can sometimes take care of the other things, just because our body systems are so involved. And as we get older, the effort made to combat the urinary tract infection can sort of exhaust some of our other systems. With older adults, we also see more erectile dysfunction. There are some great medications out there now for erectile dysfunction. And then dyspareunia is a complicated term that just refers to painful intercourse. So as women get older, their hormones levels decline, there's less lubrication, and so it hurts to have sex, and that's what dyspareunia refers to. There are medications, topical, that you can take for that. There are medications and other kinds of apparatuses that can be used for erectile dysfunction. Not always a topic that's easy to talk about, but I mention it here because it should not be something that everybody experiences. So if you're having some of these issues, please see your healthcare provider. The endocrine system, our hormones, is also susceptible to changes of aging. There's some wasting away or atrophy of the glands that secrete the hormones, but the changes are seen more in how the hormones act. So we do see some changes in glucose, or that hormone that addresses sugar, in that there's some insulin resistance, so that we might have a little bit higher levels of glucose. And you may know that older adults, particularly older adults who are overweight, are very susceptible to what's known as type 2 diabetes. Calcium metabolism changes, and it's really important to keep taking calcium as well as vitamin D to address issues of bone density changes, and try to keep our bones strong so that we don't have broken bones. And then reproductive function is a hormone action. I mentioned erectile dysfunction and dyspareunia, and some of that is related to changes in our hormones as we get older. There are some subtle changes in our stress hormones that we don't react as quickly and as easily to stress, and it kind of exhausts our bodies for our adrenal glands to be secreting the stress hormones. And then thyroid function. And we see both too much thyroid as well as not enough thyroid in some older adults, but generally we will see some changes in the thyroid gland, and then how a person responds to it relates to other changes that they might be experiencing. And with thyroid functioning, we might notice some changes in temperature regulation, maybe feeling way too hot or being way too cold a bunch of the time, and just your energy and feeling tired. Hair and nails are changing. Your hair becomes thinner. It may recede in men. It may recede in women too, and some of you may be noticing that. We see increased hair growth in the ears, in the nostrils, in the eyebrows in men. In women, we see increased hair on the chin and the lips. A lot of this relates to hormonal changes as well. There is a decrease in body hair and graying hair, which may happen at a very early age. That's more of a genetic change, or as people get older. I'm hoping this seems somewhat familiar to you, that you are recognizing you've had some of these changes, and it helps to know that this is kind of normal. Toenails get thicker. They're a little bit more difficult to cut. They may grow more slowly. They may have a slightly yellowish color to them. And so it's important to explore foot care, particularly if it's tough for you to sort of bend down and cut your toenails without causing some problems of bleeding. There are healthcare professionals who do a great job of foot care on a regular basis, and can kind of keep your feet from experiencing that sort of injury, which if your immune system is affected as well, and you cut your toenails and have some injury and bleeding, then you're making yourself more susceptible to infection. Other skin changes with aging includes that there is some reduction in the glandular activities. In other words, your skin is drier. You're probably noticing more scaly. Maybe you're not showering as often as you did when you're younger because your skin is drier. That's okay. There's less subcutaneous fat, so your skin isn't cushioned as well, which means it can be more susceptible to injury. These changes are normal, but how you manage your life on the outside in response to these changes are important. The skin is less elastic, so we see some thinning, some wrinkles, some sagging. We do see more of that with sun exposure. And I included this photo here, which is a photo of two sisters. One, they were separated at some point in their life. One grew up in a very, very sunny climate, the other in a much less sunny climate. Maybe she grew up in, the woman on the left, in Alaska like I did. So my mother and I are, she grew up in Alaska as well, have at least not had as much sun exposure in our adult years as some people. And so you see the really profound difference in identical twins related to some of what we might call extrinsic or exposure kinds of experiences. The skin can be more fragile. I mentioned that, that because it's thinner, you can have injuries and then infections, and sometimes bruise more easily, which may be related to some of your blood circulation issues, but it also can be because your skin isn't cushioning, injury as well. Only about 15% of skin aging is intrinsic, in other words, normal, what we'd expect to see. The rest of it's extrinsic. It's related to how much have you been exposed to things in your work, outside in the sun, that sort of thing. Smoking can have a real impact on a person's skin. So some other physical changes in muscles and bones. It is normal to see muscle mass decrease as we get older. It's called sarcopenia, and it can lead to decreased strength. And that really, we see that starting at about age 40 or so, that muscle mass starts decreasing. Exercising is great for reducing the decline. In other words, the decline is slower if we stay physically active, but the decrease in muscle mass does occur. And tendons and joints stiffen. So about 65% of people age 65 and over have some stiff joints. But osteoarthritis is not a normal change of aging. We just see it more often in older adults. And then bone density, that bone matrix, how solid are our bones. It does decline. It occurs in all older adults, although we hear more about it in women because there's more of a sudden change as they go through menopause and have bone density changes, given they're no longer having the hormonal estrogen protection. But both men and women experience bone density changes. And those changes can include not just changes in our leg bones and our arm bones, but we can lose height because those bone density changes occur in our vertebrae as well. And if it's really a drastic change, it might be described as osteopenia or osteoporosis, but that is not an expected normal change of aging. It's age related. It can be more so in people who have not engaged in a lot of weight-bearing exercises over their lives, in people who have not had a lot of calcium and vitamin D intake, and so sun exposure is important for vitamin D metabolism. But the osteoporosis as a bone density change is more age-related. The gradual changes are what we see in all older adults, and it doesn't necessarily have that profound impact that osteoporosis might have, which includes increased falls and that sort of thing. In healthcare, we talk a lot about function, and so I wanted to mention why we do that and why do we think about function and that it's important. Well, it's important because as some of these changes, more so the age-related changes, progress, it's important to start planning ahead for more formal services, supports, thinking about, are your personal care changes, personal care needs changing? Do you need help with some things? Are family and friends available to help you get places, for transportation, for housekeeping, environmental accommodations? It's just so easy these days to find some of those handrails or guardrails that you can put up in the bathroom so that you can grab onto them in the tub and not fall. And then thinking about formal services and supports such as home care. In other words, maybe someone else could come into the home once a month and do the heavy cleaning so that you can stay in your home, which is sometimes very important for people, but it's also important that you don't injure yourself when you're doing some of those more heavy house cleaning. Another thing to think about is considering new living arrangements, because the increased personal care needs, having available family and friends, having the environment set up to accommodate your needs, and having some help with some of those home care things often can occur in living arrangements that have those supports available. So we talk about congregate housing facilities like Issaquah, University House Issaquah, that a lot of older adults are looking for, to be able to still age in place with friends and family and an active life, but have those more formal services and supports available as well. So I do want to mention that our focus at the School of Nursing and my focus as a researcher is more on disease prevention with a goal towards healthy aging, but not thinking it's so important to stay young. It's just important to live a healthy life and to age with health. I encourage you to take advantage of, if you haven't, I think probably most of you are receiving Medicare, or you're at least signed up, but maybe you haven't had your first Welcome to Medicare visit, which is a wonderful time to get a lot of the kind of preventive services and preventive needs evaluated, health promotion kinds of issues, advice about nutrition, advice about smoking cessation. And then again, each year, Medicare covers an annual wellness visit, which again incorporates a lot of those kinds of health promotion strategies, as opposed to just treating diseases or problems that you might have. I mention this because 70% of the physical decline, 70% of that change in function can be modified by stopping smoking, by improving your nutrition, by staying physically active and controlling your weight, by preventing those injuries from falls. And so continuing to weight bear, but also make sure your calcium and vitamin D levels are up there so that your bone density doesn't fall below the level where you are at risk for having fractures when you fall. And then improved use of prevention services. There's some great nutrition counseling that's available. And so just thinking through these things. I went to a conference in New York several years ago, and it was called The Grand Challenges of Aging. And what was really interesting is a lot of the researchers were really focused on thinking about what is that magic bullet, almost that fountain of youth kind of thing that's going to increase our lifespan and allow us to live longer. But the researchers that took a look at these kinds of aspects, if those aspects are addressed, when you look at populations, that's what increases our lifespan, is addressing these kinds of modifiable risk factors, as opposed to finding some sort of medication or treatment that's going to help somebody live longer. There's certainly always indications for that, but if you think about these 5 things, it's going to do well for you. I do want to mention a few things like alcohol effects, because we hear a lot of confusing information. Sensitivity to alcohol does change as we get older, and older women are more sensitive to alcohol than men. The change, when you drink alcohol, the effects can come on more quickly, and alcohol can take longer to break down. There is a greater risk of accidents. And as we get older, we are usually, I think it's like most older adults are on at least a couple of medications, and there are many medications that don't mix well with alcohol and can be dangerous for things like driving and that sort of thing. So, and heavy drinking can make some health problems much worse. But there are some health benefits associated with moderate alcohol in terms of relaxing and that kind of thing. So it's sort of a mixed bag. And the key thing to remember is really no more than 7 drinks a week, no more than 1 or 2 drinks in a day. And that might be slightly lower for women because they are more sensitive. And so if you can sort of enjoy the benefits of the relaxation and that sort of thing at the end of the day with alcohol, but not overdo it, not take the risks, then that's an important thing to keep in mind. And then smoking cessation. As we get older, I hear from people saying, what's the point of quitting smoking now? And this is just a chart that sort of shows people who have stopped smoking at age 45, those who stopped smoking at age 65, compared to people who continue to smoke regularly. You can see that the lung function is better. This is a chart that shows declining lung function, or what lung function is remaining. And you can see that for a smoker, it declines quite a bit. But even if you stop smoking at age 65, you can shift that decline so that you have less effect on lung function. So take advantage of local programs and medications that are available to stop smoking. It reduces the risk for those age-related changes like emphysema and bronchitis, as well as many cancers and cardiovascular disease. And then nutrition can be affected by changes of aging, because if we have sensory changes, food doesn't necessarily taste as well, tastes different. We do have some oral and gastrointestinal changes, so it's important to think about your ability to swallow and to make sure that you're not trying to eat and talk at the same time, for example, because sometimes changes in those muscles throughout in the mouth, in the back of the mouth and down the throat can impact how easily the food travels and how we tolerate the food that we eat. The muscles and bones in our body can affect our nutrition because we're not getting up and around. We might not feel like preparing foods or going out and eating with friends. And so those are things, but, and increased body fat can change our nutrition because it seems to decrease our willingness to eat healthy and to move around and think about the choices that we make within our food. So changes of aging, all of these normal changes can impact our nutrition. And other changes that we might experience associated with all of that can affect our dietary intake. Oh my gosh, the social isolation that we've experienced with the pandemic, the loneliness that might come from loss of friends, as well as the loss of a partner. It makes it just less motivating to really think about healthy, colorful, intricate meals. And so trying to work through those changes and ask for help is important. Food insecurity refers to the fact of, do we have enough money to buy the good foods? You know, unfortunately, sometimes the really unhealthy packaged foods are less expensive than the really good foods, fresh fruits, fresh vegetables, meats, that sort of thing. And so other changes, if we're having some impact on our financial situation, can affect dietary intake. So the recommendations related to nutrition are to focus on having a healthy plate, a lot of colors, emphasize the food matrix, in other words, real foods over supplements. I talk with older adults at times, and when I ask to sort of see their medications, then they bring even more medications that are the supplements they're taking, because they understand this supplement can help with one thing and this supplement can help with another. But to be honest, the research seems to indicate if you get those nutrients through food, it is so much better for you. And in fact, I've participated in as a researcher in clinical trials where we've had to stop the trial because there were early results that would indicate this nutrient helps prevent this disease. But if you just give that nutrient through a supplement, there's all kinds of other problems that can come about. And so we've had to stop the trial and focus more on real foods, the food matrix, what we might call. And then physical activity has multiple health benefits. And those health benefits of physical activity can occur regardless of your other risk factors like smoking. Some activity, any activity is better than no activity. And the more active you are, the more benefits you experience. I show a picture of somebody doing Tai Chi because there's a great amount of research that indicates Tai Chi is a really good physical activity for older adults and can improve health and prevent sort of that spiral of problems that come about if we become less and less active. Recommendations are 3 or more days of some sort of activity each week, ideally combining flexibility, endurance, and strength. And Tai Chi does a lot of that, but also specifically balance. Sleep hygiene. So we experience a lot of changes in sleep, and some things to think about as we get older. Sleep changes are not a normal change of aging, but we see sleep changes more often. So if you're having difficulty sleeping, use your bed only for sleep and sex. Don't lay around in bed worrying and fretting about not being able to sleep. Instead, the idea is to get up out of bed before trying to sleep again. Prioritize sleep quality, have a restful environment, a good temperature, which usually is cool, good ventilation, and keep the lights down. And I show this picture of a woman taking a look at her cell phone because the blue light of cell phones, plus just that distraction, can really interfere with a person's sleep. So get that cell phone ideally in another room when you're trying to go to sleep. Follow rituals at bedtime, go to bed at the same time, get up at the same time, and have a kind of a preparation or relaxation for about 20 to 30 minutes before you go to bed. Avoid napping in the late afternoon, avoid going to sleep too early, and late in the day, try to avoid heavy eating. Remember, I mentioned how the gastrointestinal system, the stomach motility can slow down a bit. So if you eat later in the day, the food's hanging around and your body's trying to digest it. Avoid alcohol and caffeine, avoid smoking, and exercising late in the day is problematic, but daytime activity will promote sleep later on. And when you're trying to sleep, try to avoid thinking about life issues, doing a lot of problem solving, rehashing the events of the day. Those rituals can help with sort of moving you away from those ruminating things that occur that keep us awake at night. Falls in older adults is an issue, and particularly it can lead to fracture if we have decreased bone density, but they can be preventable. And so some things to think about are having your environment set up to avoid falls, such as well-lit rooms, avoiding stairs where that are slippery or where you can't see the shadows in them so that you don't fall, and have guardrails or handrails available in your home so that you can grab onto them. One of the interesting things, and I always quiz my students about this, and it's always a surprise for them, is that the greatest risk of falling is fear of falling. So people who are afraid of falling are at much higher risk for falling. And why would that be? Well, it's because they, if they're afraid of falling, they might limit their activity. They might get anxious if they have a little bit of unsteadiness. And given that we don't react to changes physically or neurologically as well, then that anxious reaction means we have a slightly unhelpful strategy or reflex to balance changes, and so falling can result. So some questions to think about is, if you've fallen before or you stumble often, you might be more afraid of falling, and you might be more likely to fall again over the next year. So thinking about, are you taking medications that increase your risk of falling, or your balance, or your alertness? Are you in an environment that is making it more difficult? Are there a lot of stairs in your environment that can increase your unsteadiness? Do you have handrails? Are there, or other things to hold on to? Are there loose rugs and wires, you know, phone cords and things in your household? Those are all the kinds of things that you can take a look at and maybe fix so that you can prevent falls. So I said I was going to finish up with healthy aging, and what do I mean by healthy aging? Some researchers developed the idea of successful aging, and some of us have not really liked that term because it seems to be a little bit competitive or ideal. Successful aging by these researchers was defined as having optimal and almost no problems with physical function, cognitive function, and fully socially engaged. And that's kind of hard when we get older and we experience all of these normal changes of aging, not to mention age-related changes. And indeed, research that these researchers and others have used to evaluate successful aging would indicate that only about 20% of older adults meet the criterion for aging successfully. And yet, if you ask them, if you ask older people, to what extent are you aging successfully, 50% at least say that they're aging successfully. And the difference really is because as we get older, we do experience health condition changes. We do experience physical function and cognitive function changes, but we recognize that we're doing pretty darn good in spite of all of those changes. So our focus in gerontology is really on aging well. In other words, rather than a huge focus on prolonging life, we also incorporate a focus on quality of life. And so some truths about aging that I emphasize with my students is that most older adults do very well and age successfully, even with chronic illnesses. It's never too late to learn to develop new health habits. It's never too late to start and benefit from those. And so not just adding years to your life, but adding life to your years, quality of life to your years. And these are some great website resources, and I made these slides available so to University House Issaquah, so that if you don't have time to take it down, they have this information. But it's so hard when you are wanting health information and you go to the web and there's all these websites and you just don't know what to trust. These are websites that you can trust. The National Institute on Aging and the American Geriatric Society have information specifically for older adults, not just for scientists, not just for healthcare providers, but for older adults. And so these are great places to get information and have your questions answered, learn more about the health conditions that you might have. And I just close with this. I mentioned I'm from Alaska, so this slide seems particularly appropriate. But the idea is, as we get older, finding opportunities in the challenges that we experience, because that can also have benefits. We've survived and we are doing very well. And people have a lot to learn from older adults about how to live well. And I'm happy to answer any questions.
Barbara, we did have one question about calcium, and can you speak to what happens when you take too much calcium, or how do we know how much is too much calcium?
There are some, a key thing is that the recommendation is usually about 2,000. I think the measurement is milligrams per day. But one of the key things to think about is not just taking calcium, but instead also making sure that your vitamin D levels are appropriate and that you're getting exposure to sun, which increases your vitamin D levels, or taking some supplemental vitamin D as well, because vitamin D helps with our absorption and metabolism of calcium. And so the effects of too much calcium that we've been concerned about are things particularly like kidney stones. But we usually, people are regulating their calcium well enough. And the issue that we see most often in older adults is that they don't have enough calcium, or their calcium levels are low. And as I said, increasing vitamin D can help with that as well. I hope that answers the question.
Thank you.
Mm-hmm.
And can you recommend further resources related to tendon issues in aging?
Well, I think the National Institute on Aging is a great place to go to get some answers about tendon issues, but physical activity and doing some stretching exercises can really help with keeping tendons loose. And then there may be, because of all of the changes that we experience, if you're also having very profound changes with your tendon, and I'm sitting here wearing a finger splint because I've got a problem with the tendon in my finger from too much computer mouse usage. Just taking a look at possible treatments and seeing a healthcare provider about ways to perhaps relax and stabilize a tendon while it has some chance to heal.
Thank you, Barbara.
Mm-hmm.
Okay, well, it looks like we don't have any further questions. So we just want to thank you again, Barbara, for your incredibly informative presentation today. We really appreciate your time. We will email everyone an evaluation form following today's presentation, and we'd love to hear your feedback so that we can incorporate your suggestions in future Zoom presentations. If you have any questions about our Community University House Issaquah, or any further questions for Barbara, you're welcome to give us a call at 425-557-4200, or you can send us an email at isqcr@airliving.com. Again, I'm Carly Christensen, the Area Community Relations Director here at University House Issaquah, and this concludes today's presentation. Have a wonderful day, everyone, and thank you so much for being here.
Thanks for your kind attention, everyone. Went pretty fast through things, but I hope it was useful, and I look forward to seeing you in person someday soon.
Thank you so much. Bye, everyone.